بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. I'm here, Dr. Mudassir Shabazz, Associate Professor, Sahara Medical College, Narwal, and today we are going to discuss about the skin, fascia, superficial and deep fascia of the lower limb. In the previous lecture, we have discussed about the general introduction about the lower limb, and we have seen that what kind of similarities are having the lower limb with the upper limb, and also have come to brief knowledge of the bones and joints and muscles, nerves, and the vessels of the lower limb. And that was a brief discussion. Now we will start now onward about the detailed discussion of the each thing which we are going to discuss in the lower limb. The skeletal system will be discussed with you people by some other teacher. Now I'm here to discuss with you the first thing, that is the skin and fascia of the lower limb. The skin of the fascia, the skin of the lower limb, just like the other part of the body of the skin of the other part of the body, but at certain points it is different, such as at the sole of the foot. If you feel it, it is very much harder and thicker as compared to the other parts of the body. And at some places, the skin is very much adherent to the bones, where you can feel the bones. Otherwise, basically, the structure of the skin is the same, and there are certain folds which appears in the skin due to the flexion or due to the other parts of the body, such as the gluteal fold, which is on the posterior side under the gluteus maximus. Anteriorly, it is the inguinal region. There is a crease, inguinal crease, which is at the level of inguinal ligament from the anterior sphenoid spine to the pubic tubercle. So that the inguinal fold. Here we can see, here is the inguinal fold, and there other folds are developed where the joints are present. So it's the skin. The main purpose to know about the skin is that the cutaneous innervation, by touching the skin, that we can check the innervation or dermatomes of the skin. So it is very important when you are studying the skin the of the any region. So you have to know the crease lines and the dermatomes. So first we see that here the anterior part of the thigh, which is supplying by the certain cutaneous nerve above, starting from above, is a femoral branch of genitofemoral nerve, as the on the most upper and medial part is the ilioinguinal nerve supplying the upper and medial part of the thigh, and then coming down there is, on the lateral side, there is the lateral femoral cutaneous nerve. These are the branches of the femoral nerve, and then there are the intermediate cutaneous nerves, and then there is the medial cutaneous nerve of the thigh. So if you will check here, you will checking the femoral nerve. On the medial side of the thigh, there is the cutaneous branch of obturator nerve, and here is the marked area, which is area of the femoral triangle, which is supplied by the femoral branch of genitofemoral nerve, ilioinguinal nerve, and cutaneous branch of obturator nerve. Below the, near the, just above the knee, here is the saphenous nerve, which is coming out of the front of the thigh, and it will supply the leg, and there is the infrapatellar branch of the saphenous nerve, which is supplying it. And here, if we go to the posterior side of the thigh, we are seeing the lateral cutaneous nerve of the thigh, and that's the L2, L3, and then there is the posterior cutaneous nerve of the thigh. So on the medial side, we see obturator nerve supplying the medial, and below this the medial cutaneous nerve of the thigh from the above. So below, if we see as a whole the picture of the cutaneous nerve supply, so this is showing the anterior side and this is showing the posterior side. On anterior side we have seen these branches. Below there is the saphenous nerve which is supplying the anteromedial part of the leg and up to the big toe. On the lateral side we are seeing lateral cutaneous nerve of the calf, and here is the superficial peroneal nerve. On the lateral side of the foot, sural nerve. These are supplying the front of the leg. And on the posterior side we see here is the cutaneous branches of subcostal nerve most laterally. Then we come, if we come medially, see L1, L2, L3, and branches of posterior MIU of S1, S2, S3. They are supplying the gluteal region. From the lateral side, iliohypogastric is coming into to supply the lower outer quadrant of the gluteal region. The medial quadrant, lower medial quadrant, is the perforating cutaneous nerve and perennial branches of the posterior cutaneous nerve of thigh. They are supplying this area. Here is the posterior cutaneous nerve of the thigh. Then on the medial side, here is the above the cutaneous branches of obturator nerve, and the here low down is the medial cutaneous nerve of the thigh. On the lateral side of the leg we see lateral cutaneous nerve of the calf, and here in the midline is the sural nerve, very important sural nerve, and going up to lateral malleolus. On the medial side is the branches of the saphenous nerve which is supplying. In the foot there is the branches of lateral plantar nerve and branches of the medial plantar nerve. So here is the cutaneous nerve supply of the lower limb, and if we check this we can confirm which part of the is deficient or damaged or not. So we can check the nerve supply of the ulna. Here you can see we can the segment of the spinal cord involved can be checked by checking these cutaneous nerves. And similarly, there are the in the superficial fascia there are the veins, superficial veins, which are very important in the leg. So it is very important to know about the veins, superficial veins of the leg. So there are superficial veins in the thigh region. There is great saphenous vein that ends at this phenofemoral junction, which is at present at the saphenous opening. That this great saphenous vein is opening into the femoral vein. Because it is long one, that's why it is called as great saphenous vein. Posterior on the posterior side of the lower leg there is another vein that is shorter one, and that small saphenous vein. That saphenous vein opens into the popliteal vein inside, and that's why is this phenopopliteal junction. And there are in this side here are the perforators which are connecting the superficial veins with the deep veins. These are very important to know about, and we will discuss in the when we will discuss the superficial veins of the leg, we will discuss these veins also. So there are two veins, superficial veins, great saphenous vein and small saphenous vein, and there are perforators which are connecting these veins with the deep veins of the leg. So regarding the skin, there is superficial lymphatics that drains mainly the skin of that area, and that drainage area is superficial tissue, everything which is superficial to the deep fascia. So in the lower limb, including the buttock, except posterolateral part of the calf, posterolateral part of the calf, this one, this area, which drains to the popliteal lymph nodes. Lower abdominal wall below the umbilicus. So these are superficial inguinal lymph nodes which will be draining the whole of the leg. And as the external genitalia is also drained, that not includes testes. Testes are not included, only the skin. then the perineal, and then the uterus corona. These lymphatics are drained by superficial inguinal lymph node. So, skin of the lower limb is drained mainly by the superficial inguinal lymph nodes. And here we are seeing that there is a horizontal group which is lying horizontal superficial inguinal lymph node, and there is a vertical group of lymph nodes which is lying vertically at the inguinal vertical to inguinal ligament. The superficial one is lying parallel to the inguinal ligament, the horizontal group, and the vertical group is just vertical to it. This is superficial inguinal lymph nodes. The skin is drained by here, and these obviously will be connected to the deep inguinal lymph nodes through the superficial to the deep. Here we are seeing there are popliteal group of lymph nodes, popliteal group of lymph nodes that drain posterolateral part of the cuff into the popliteal. Just like you can compare it with the upper limb, that in the upper limb we have seen there were a group of epitrochlear lymph nodes in the cubital fossa. In the cubital fossa there were present the trochlear lymph nodes, and they are comparable to the popliteal lymph nodes in the lower limb, which are draining only posterolateral part of the calf. Okay, then comes the fascia. So when we see the fascia of the thigh, there are two types of fascia. One is superficial one, and other is the deep fascia. So superficial fascia and deep fascia. So is the superficial fascia, number one, is the mainly the fatty layer of the fascia, which is, and here lies the cutaneous nerves and also superficial arteries and veins in the superficial fascia. So two types of fascia, one is superficial and the other is deep. Here we are seeing the superficial fascia, and here is in the superficial fascia is a opening which is named as saphenous opening, because of here the great saphenous vein opens into the femoral vein. We'll see where it's located and how it is located. Here is shown the branches of the venous branch, superficial branches of the veins draining into the great saphenous vein, that is the superficial external pudendal, then the superficial epigastric, then the superficial circumflex iliac, and also here are the group of lymph nodes are also shown. Here is the horizontal group of lymph node of the superficial inguinal lymph, and here is the vertical group of the inguinal lymph nodes. And here is the branches of the femoral artery, which are similar to that of the superficial veins. That is the superficial iliac artery and vein, superficial epigastric artery and vein, superficial external pudendal artery and vein. Here is shown. So, the superficial fascia is basically divides into two parts, where fatty and deep fascia, superficial and deep. Now here we see in further detail that the fascia of the thigh in two layers, superficial and deep, and superficial is further divided into two, superficial fatty and deep membranous. In this slide we are seeing here, this is the layer superficial fatty fascia, but here is the line which is seen here is the membranous part of superficial fascia, which is more concerned with the abdominal part, that you will study when you will study the abdomen fascia of the abdomen. Here that will be more important than the superficial, but in the thigh it is very smaller one, and it's just below the inguinal ligament, the deep membranous layer fused with the deep fascia of the thigh. Here it is fusing with the deep fascia of the thigh. So it's not extending beyond that. So we can say that actually the below this at a fusion there are only two layers: superficial fascia, fatty and deep fascia of the thigh. But above this there is, because this attachment is below the inguinal ligament, so we have to mention it that the two layers, superficial and deep membranous of the superficial fascia. The other one is the deep fascia, which is also called as fascia lati. Fascia lati means it's a stocking like that if you wear stockings over your foot or over your thigh, so tightly they embarrasses your thigh or lower limb. So that's why this is called a fascia lati. Here again shown the superficial fascia of the thigh, that's the membranous layer of superficial fascia of anterior abdominal wall, extend into the thigh and is attached to the deep fascia, fascia lata, below the inguinal ligament. So actually the membranous layer of superficial fascia of the thigh is not the part of the thigh fascia, but it is coming from the abdomen, the membranous layer abdomen. The superficial mainly composed of fatty layer of superficial fascia on the anterior abdominal extend into the thigh and continues down over the lower limb without interruption. So it's mainly the fatty layer. The deep layer, membranous layer of superficial only up to the below the inguinal ligament, it fuses with the deep fascia. That's very important point to remember. So here comes the deep fascia. This deep fascia of thigh is strong and closes the thigh like a trouser leg. It is called as fascia lata. Its upper end is attached to the pelvis and the inguinal ligament, or around the pelvis means the iliac crest, and then the on the inguinal ligament, and here posterior will be the sacrum. So it's attached to the inguinal ligament and the pelvic brim, all of the pelvic brim. On the lateral side, it is thickened to form the iliotibial tract. Here is on the lateral side is thickened to form the iliotibial tract. Ilio from the ilium to the tibia, iliotibial tract. So iliotibial tract is nothing but the thickening of the deep fascia of the thigh. In the gluteal region, deep fascia form the sheath which encloses the tensile fascia lati and gluteus maximus muscle. So here in the gluteal region, this deep fascia will divide into two parts and will enclose within it the gluteus maximus and tensor fascia lati muscle. Here will be tensor fascia lati. Here is shown tensor fascia lati muscle, this one, and here is the gluteus maximus. So the deep fascia will divide into two parts and enclose this tensor fascia lati and this gluteus maximus muscle. So these are the modification of deep fascia. So what about further about deep fascia is that the modification, there is a gap in the deep fascia which is named as saphenous opening. This gap is in front of the thigh just below the inguinal ligament. Why this gap is here? This due to great saphenous vein has to enter into the femoral vein. So this is named as saphenous opening. Okay, and this gap where the saphenous opening is present is filled with connective tissue which is named as cribriform fascia. Although this is not a fascia but it's a loose connective tissue that fills the gap of saphenous opening, but it is named as cribriform fascia. Now here is the showing the saphenous opening. This is important clinically to know about the opening of the saphenous opening, where the in case of varicose veins you have to ligate it, so you should know its location. It's located 4 cm below and 4 cm lateral to the pubic tubercle, and it is around about 2.5 cm long and 2 centimeter broad, with its long axis directed downwards and laterally. So here downwards and laterally, it is when you have to palpate it. First you have to palpate the pubic tubercle. Here is the pubic tubercle, and you have to go 4 centimeter down and lateral, 4 centimeter lateral to the pubic. There you will find the vein, saphenous opening. Here again shows the ovoid opening, ovoid hyacid, that is the saphenous opening, and here will be the pubic tubercle, and here is the vein. This is a gap in the fascia lati, and here is the great saphenous vein is entering into the femoral vein, and here is the inguinal ligament attaching from the anterior superior iliac spine to the pubic tubercle, and here you can see the deep fascia attaching to the inguinal ligament, deep fascia here, and below this the membranous layer here round about, I think so, here round about here will be the attachment of the membranous layer of the deep fascia, fusion of the deep fascia and membranous layer of the superficial fascia, they fuses with each other. Here we again see the opening of the, and here is the attachment of the deep fascia, and in the gluteal region, and is now sleeves all of the, here are again you are seeing the two gaps, one is over the patella to communicate with the bursa, and here is another below where is the ligamentum patelli is attaching on the tibial tuberosity. So if you go down, fascia lati is a deep facial investment of the musculature of the thigh, is analogous to strong, extensible and elasticated stocking proximally around the iliac crest and inguinal ligament, and distal to the bony prominence of tibia, continuous with the renamed deep fascia of leg, that is the crural fascia. So the same fascia of the thigh, but down in the leg it will be called as crural fascia. The depth varies considerably according to the thigh. Thickest along the superlateral aspect of the thigh, where it is arises from the facial condensation of gluteus maximus and medius, and thick around the knee, where fascia receive reinforcing fiber tendons of quadriceps. Facial investment thinnest where covers the adductor muscles of the medial side of the thigh. So it's thick where over the quadriceps, but thin where over the adductor muscles, and also thick over the gluteus maximus and medius. Okay, so fascia lati, these are the qualities of the, again here is showing the iliotibial tract, that is the thickening of the deep fascia, and here the tensor fascia lati muscle will be attaching to the iliotibial tract. Now, from the deep fascia of the thigh, fascia lati, certain septums they move inside and attach to the bones inside femur, and similarly in the lower leg, and they will be called as intermuscular septa. So in this way it divides the region into different compartments. So here if we say here is the lateral intermuscular septum, and here is the that the medial medial intermuscular septum, and here is the posterior intermuscular septum. So between this septum lateral and this posterior is the posterior compartment, here is the adductor compartment, and this will be the anterior compartment of the thigh. And so you are seeing here that it is investing the muscles of the thigh. The fascia is investing the muscles of the thigh. So these are the modification of the fascia lati, that is the iliotibial tract and the intramuscular septums. And again, here is the showing the tensor fasciae lati muscles and its insertion into the iliotibial tract. And its main action is to flex the hip and internal rotation, abduction of the hip. So it is more concerned with the stability of knee joint and some action over the hip joint. But it is because it is, I have shown it here because it is attached to the fascia lati of the deep fascia of the leg, deep fascia of the thigh. Below this, the deep fascia of the thigh is continuous with the deep fascia of the leg, that is called the crural fascia, and it is attached to the patella, patellar ligament, tibial tuberosity, and crural fascia attached to the tibial condyles and head of fibula inferiorly. So at the ankle joint, deep fascia is thickened to form the retinacula through which the under which the muscle tendons they pass to reach the foot, and so these are the modification of the fascia. Actually it is a continuous fascia. Here it will be called as crural fascia. Then at the ankle joint it will form the retinacula of the ankle joint, which will be covering the muscle, which will covering the tendons. And in the foot, in the sole of the foot, then similarly when we have seen in the palm, this is the palmar fascia, palmar aponeurosis. Here the plantar aponeurosis will be formed by thickening of the deep fascia, but it is quite thicker than in the upper limb, that is the palmar fascia. So that's the plantar fascia is quite thicker than the palmar fascia, and distally it is fibrous digital sheath attached to it, and also transverse metatarsal ligament, which are obviously because continuous putting stress over the foot during walking, so it becomes more thicker as compared to the palmar aponeurosis, palmar fascia or palmar aponeurosis. Here is the plantar fascia or plantar aponeurosis will be formed by the thickening of the deep fascia. So here are the about the skin and fascia of the lower limb. We have seen in the skin it is the more important as the marking, that is where the bones can be palpated, where the lines are present, that is the gluteal line and inguinal lines, they are present. And also the more concern are the superficial cutaneous nerves which are supplying the skin, so that we can check the sensation of the skin. And then the superficial veins which are located in the superficial fascia, and veins and arteries, and then the superficial lymphatic. Then we have discussed about the deep fascia, which is fascia lati, and we have seen it's modification thickening fascia lati, that is iliotibial tract laterally, and the opening in the fascia lati, that is saphenous opening, and intramuscular septas, and other modifications of the deep fascia at the knee joint, that is the crural fascia of the leg, and at the ankle joint, that is the retinacula of the around the ankle joint holding the tendons, and in the foot we have seen the thickening, that is the plantar fascia. So this is about the skin and fascia of the lower limb. Thank you very much. Inshallah, we will discuss further accordingly.